This is your Houston chiropractor, Dr. Gregory Johnson, and we have Jared here with us today for his very first visit, and he has a very large herniated disc at L5-S1 that is causing what we call lumbosacral radiculopathy. A lot of you call it sciatica, going down his leg into his calf and into his foot, and that's been going on since August?
9 months.
Yeah, 9 months now. And you've been to how many surgeons?
7 spinal surgeons.
7 spine surgeons, and they all wanted to do surgery on you. Have you had any ESIs yet?
I actually have had 2 epidural steroid injections.
Did that help you at all?
Minor. The chiropractor that I was at for 6 weeks helped me.
Okay, good. And John Bergman out in California did help him, which is good. And what else have you done for this? Pain pills, muscle relaxer gig?
I was doing ibuprofen all the time up until I found out.
That causes the kidney problems.
Epidural steroid inject. So I cold turkeyed that, so I haven't taken any pills.
Okay.
But yeah, physical therapy, acupuncture.
Did physical therapy help this at all?
No.
Yeah.
No. I mean, the only thing that's helped me is going to chiropractor.
Okay, good. Well, you're going to see his full examination here today in first treatment, so I'm going to have you face the mirror for me first, Jared. And I'm going to have you put your feet shoulder width apart and even. And I want you to close your eyes and bend your head forward and backwards for me, please. Keep them closed and go back to neutral. Take a deep breath in, let all your air out, and relax. There we go. Now, as you can see, he's got a little bit of forward head posture and his head's cocked off to the right. He's probably on the computer a lot. Are you?
Sometimes, yeah.
Yeah. Okay. Yeah, you get some neck and upper back tightness there too.
Yeah. I just bought a new mattress too. So.
Oh, now that's probably doing it. Okay, so I'm going to have you. We're going to do some orthopedic neurological tests on him now. While you're standing though, Jared, I want to see if you just bend over like you're going to touch the floor. Does that cause any pain in your lower back or your pelvis or your leg?
It just causes the nerve to tighten up.
It does, all the way down?
It doesn't shoot pain, it just like...
Do you feel it pulling all the way in there?
That's about as far as
okay.
Like
so that's a positive flexion test with radicular phenomena. If you go backwards, does that hurt?
I can feel the disc
more on the right side
a little
there.
bit, but
okay.
yeah, just kind of...
Now he's got a posterior lateral disc herniation, so, and it's to the right. I'm going to have you cross your arms here. We're going to lean backwards, and I'm going to twist you to the right. Keep your knee straight. I'm going to push down. Does this make that worse?
A little bit.
How about when we go over to the left and down? Does that make it any worse?
No.
Okay. Now just stand straight and lead left and stretch. Does that cause any problem anywhere?
No.
How about when you do that same thing to the right?
Yeah, a little
More
bit.
so on that side?
A little bit.
Down in here? Yep.
Yeah.
How about when you just twist left?
A little.
A little pulling?
Yeah.
Okay. How about when you go on this side? See, he has a normal range of motion, but he still has the nerve pressure shooting down into his SI joint and into his leg. So, okay, let's go ahead and lay on your back on this table first with your head up here. Now, this is called a straight leg raise test. This is a standard orthopedic test, neurological test for a lumbar radiculopathy. Besides the tightness in your hamstring, tell me when this starts shooting pain down your leg. At what point?
Stop.
Right there.
Just hamstring tightness.
Okay,
The pain's
but
pretty
you're
good.
feeling it all the way down in here though? Does it get worse the higher I go?
It's not too bad actually.
Okay.
It's just really tight.
Is it going down into your lower leg at all though?
No.
Okay.
It's just tight.
Is it better down
I
here?
mostly just feel it.
Feel it in your SI
like I
joint
said
to your
before
knee?
it was bad. Now it's more just like kind of.
Okay. Does it feel better down here?
Yeah.
Okay, just let it hang in my hand. There you go. Does that cause any pain in your low back or your leg?
Do it again. No.
Okay. That's a braggart's test. That's negative. If I push down here, does it hurt in your hip joint or your SI joint?
No, just my groin.
Groin?
Almost
Okay, stretch. Okay, so we're going to do left straight leg raise. Besides the hamstring tightness, do you feel any low back pain or shooting leg pain on this side or the right side?
No.
Okay. Better down here, though, less stress? Does that cause any low back pain or leg pain?
No.
Okay, let's cross this over. I'm going to push down here. Does that cause any pelvic pain in your hip here or your back or your SI joints?
No.
Okay, good. Now, push against my hand. Pull up. Turn in. Turn out. Good. Excellent strength there. Push. Pull up. Turn in. Turn out, excellent strength, 5x5 on both sides there, that's good. I'm gonna have you lift your head up just a second. Tell me if this hurts anywhere along the course of your spine.
No.
Great, let's sit you up and face out the window there for a second. Okay. I'm just gonna push straight down. Tell me if this hurts anywhere.
No.
Now we're gonna go backwards and to the right and down. How about this one?
No.
Now let's go backwards and left and down. How about this one?
No.
Okay, let's tilt to the right. Does that cause any tightness or pain anywhere?
No.
When I do this, is that better, same, or worse?
Same.
Okay, how about when you go this way? Any tightness anywhere?
No.
Okay, is this better, same, or worse?
Same.
Same, okay. Does this feel better, same, or worse?
A little better, maybe same.
That's what I thought,
Yeah.
okay. I'm gonna push down here, you hold this up. Good, that's right deltoid, that's fine. I'm gonna push down here, hold this up, that's left deltoid, that's fine. Did that hurt in your low back at all when I tested that?
No.
Okay. I'm gonna do your biceps now. I'm gonna pull out, resist. Good. I'm gonna do your triceps now. I'm gonna reposition you. Now I'm gonna push in, resist. Excellent. Do the same thing on the right side. I'm gonna pull out, resist. And now I'm gonna push in and resist. Excellent. So he's got 5x5 muscle strength throughout his entire upper and lower extremity nerves, brachial plexus in the cervical spine and the lumbosacral plexus out of the lumbar spine and pelvis. Reflexes are +2 on the triceps, brachioradialis, and biceps on the left side. Spine on C6, biceps, C7, brachioradialis, C7 on triceps, that's fine. Patellar reflexes are equal and active. Okay, relax your ankle. Okay. That right one is a little bit low.
Yeah, I said it lost maybe a little bit, but I don't feel anything.
It's not a substantial loss. Okay, let's have you lay on your stomach next with your face down in here. Other tummy. Oh, there we go. Now I'm going to examine your entire spine, starting with your feet. Now see, in this position you can see very clearly his right leg is short by over ½ an inch. Now when I bring it up, this is a very important test. See, it gets even, and I bet you this tightens up right there in your low back and that right side of your SI. Yep. So that's a positive knockless test in Deerfield on the right. And he's got a sacral deviation right here on the right, and his right SI joint's misaligned right here. That's probably a little tender to touch.
Not too bad.
Left one right here. Okay, I want you to lock your right leg straight and lift your whole right leg off the table. That's excellent. Now do the same thing with the left one. This was a little more difficult over here, wasn't it? To lift up? Yeah, didn't go as high. Is that a little tender right there? Because that's L5 right there.
It's not too bad.
Not on the right there either. See, he's got paraspinal muscle hypertonicity and a loss of the normal cervical or lumbar lordosis here because the vertebrae have gone retrolistesis. That means they've slipped backwards. A little tender right there. This is probably the most tight right here in the thoracic lumbar, right? Yep. And I bet you that's tender right there. Okay. Right now I'm just palpating his spine, finding out where his spine's misaligned. He's got some lower cervicals here in the lower neck. That's that one I'm showing you on the x-ray. We've already looked at his x-rays and MRIs. Tender right there too. Does he get some headaches here occasionally? Like to make your skull not bad? Okay, you ready to feel better?
Yeah.
Okay, so we're going to give him his first adjustment today, which will be three-dimensional in nature. I'm going to adjust his right SI joint first. There. Now, after looking at his x-rays, he does have an asymmetrical facet at L5-S1, so I am not going to do a lateral side posture adjustment on him for that reason. I have one of those myself, and I know what that feels like. It usually hurts more than it helps. There. Means you've got one facet in the sagittal plane and one in the coronal plane. And when you try twisting those, they lock up and it hurts even more and stretches the ligament and causes ligamentous instability. For those of you who wonder why I don't do a lot of lateral side posture lumbar spine adjusting, that's the reason. I don't want to create ligamentous instability in the SI joints or the lumbosacral spine region. Just exhale and relax. There you go. There we go. Good job. Now I'm just going to do some lateral oblique stretches here. You know, we see a lot of people here that we're kind of their last resort before they go to get surgery. I don't know if that's the case for Jared yet. We're going to try to prevent him from having to have surgery by decompressing his spine, our famous ring finger. There we go. And correcting his biomechanics in his sacrum and his pelvis. Now see, the leg's only about 1/4 of an inch short now. And I bet you this doesn't tighten up as bad as the first one.
No, not really.
Okay, good. So, I'm going to get pretty deep on you here with this one today, Jared, so take some deep breaths. This is my human meat tenderizer. It's a puppy. Release tool that we had developed and made for us. It's from a Black & Decker jigsaw, yes, for all of those of you who hadn't heard that before. But it gets very deep. I had this special pin put on here and length put on it so I get depth into the tissues. And anybody that's ever had this done knows that it's very deep, but it's very effective for calming down the soft tissues and breaking up the fibrotic adhesions that develop in and around joints. Now, look at your leg length now. It's better. It's more even now. And how's this deal compared to the last one? A little better? Okay, so I'm going to put your head forward a little bit on this one, Jared. And scoot down this way just a little bit right there. Now I'm going to pop up your cervical piece here. I'm going to adjust the curve back forward in your neck. And looking at his cervical spine x-rays, he did have a block of vertebrae from C2 through C5 that had straightened out, which means he had a lack of his cervical lordosis. And that's instrumental all the way down in the spine. Okay, let's turn you on your back now. Now, because of the size of his L5-S1 herniation, drop this right in my hands here now. That's it. Same here. Nope, I got another one. Just let me go right a little bit. That's it, better. Okay, leave your head right on that headpiece. Okay. There. Lifting his head up and back up over his shoulders now to put that lumbar lordosis, or that cervical lordosis back in. Now slide straight down a little bit, about an inch, 2 more. There you go. Now put your arm straight out to the side like this for me, Jerry. Alright. I'm going to adjust his AC joints. There, his sternoclavicular joint right here, which also relates to the thoracic spine vertebrae in this posterior aspect. want you to just relax your whole leg in my hand here. Put your hands on your tummy. There you go. Now you should have felt that in your knee all the way up into your pelvis, even into your lower back. Okay. There we go. Same thing there. Good job. Let's sit you face this way towards you, Joseph. And when you get up, you always want to sit up sideways, because if you sit up straight, the vertebra will slip backwards.
And by the way, I did have surgery on this. It was pretty minor.
Rotator cuff?
Yeah.
Okay, just relax it for a sec. Look straight ahead for me. So we're just going to move this shoulder around through a circumduction range of motion. Doesn't have a lot of crepitus in there though. Just going to adjust that gluteal joint lightly. So you got a little more crepitus actually in this one. But you didn't have any surgery over here, right?
No.
Yeah. See, they moved about the same. Okay. Right elbow, right wrist. Get the digits all the way down so we get the nerves all the way through the course of their pathway. Have you seen the really severe lady that we've been treating? The severe herniated disc lumbar?
I think so.
Lady that was all bent forward?
Yeah.
She's a lot better. She's had 5 visits.
Really?
Let's go ahead and lay here on your back on this table. So, after we've completed a extended exam, orthopedic neurological exam on him, and looked at his MRIs and x-rays, I have determined it is safe to do this adjustment. I'm going to scoot you up a little bit where your hip's right underneath that. There you go, Jared. You're going to feel this one real tight over here. Now, push away to make sure you're in there tight. Push away. Does that feel like you're in there locked up tight? Okay. This is the way you should start sleeping, by the way, with your legs elevated. If you were to go home and lay on the floor in front of your couch and put your legs up on the couch, that's how you should sleep, with no pillow on your head. Because that head being forward is what's causing all your problem. So we bring the legs up parallel with the floor. There we go. See how that changes the angle in the pelvis? That should feel fairly relaxed in your low back right now. Okay, good. Now keep your teeth together on this one. I want to wrap this wet towel around his occiput and his mandible. Take a deep breath through your nose. There you go. And just keep breathing. Yeah, keep breathing. There you go. You should have felt that all the way down. Did you? Okay, keep breathing. First one's the worst one. I get a lot better after that, don't they, Joseph?
Yes, sir.
Everybody has that kind of reaction on the first one. That's why I don't tell too many people about what's going on in the first one.
I've seen it on TV.
It's a lot different in person than it is on YouTube, though, huh?
It'll be his favorite in a couple times.
Yeah, it'll be your favorite adjustment here before long. That's all right. We get a lot of that. That's sometimes the nicer words.
It is.
All right, so let's have you sideways. Kind of get up whichever which way sideways. There you go. Now let's have you come over and stand up in front of the mirror again. Yeah, feel a little taller. Okay, now let's have you do the same thing where you close your eyes and just bend your head forward and backwards, and then neutral. Okay, take a look in the mirror now. Look at how this is equaled out in the spacing down here. But you can still see your head's a little cocked over and forward. So here's your homework. Pull up and back, and then we bring your head straight back, and because you're left, see, we're going to do exactly the mirror image of that. You feel a little tap right there. Another little tap right there. Right now we're adjusting his atlas on the x-axis, which will send messages into his cerebellum. You can relax and do that same thing where you flex your head forward and backwards again. This should feel a little smoother than the previous one. Yep, look in the mirror right now, straight though. So you're right down the gut everywhere right now. That's good. So this is a first time evaluation and treatment, including the manual spinal decompression, which y'all like calling the ring dinger. I call it the ring dinger because it gets everything. That's why I call RD ring dinger. It gets everything from the skull all the way down to the sacrum, and I'm sure you felt that, right?
Yeah.
It's a pretty intense adjustment, isn't it?
It was rough, but I think it'll be good.
Yeah, it will be. So this is your Houston chiropractor and Jared coming to you from Advanced Chiropractic Relief in Houston, Texas. We'll see you next time.